This episode of the Berry Chronicles is proudly brought to you by Bariatric Support Australia.
Too.
Hi, so we're here with Dr. Angela. Dr. Angela, thank you so much for joining us.
Thank you so much.
Could you just? It's really exciting, and I've honestly just been buzzing the last few days since we talked, and
He has.
telling
I
Tash,
can confirm.
but I can't wait for Tash to be able to hear it from you. So could you just tell us a little bit about yourself and what brought you to specialise in weight loss surgery?
Yeah, definitely. So thank you so much, Tash Damo, for having me on your podcast. I've been equally as excited to make my way to record your podcast today. And I've been working in general practice for a really long time, looking after patients with all aspects of their health, from, women's health, men's health, travel medicine, pregnancy care, all aspects, and of course, enjoying all aspects of it. But what I had noticed as of recently was that patients were having increasing challenges and difficulty with getting their weight under control and also to be able to maintain their weight in the long term.
Yes.
And I also felt a little bit quietly dissatisfied myself as a GP in that the system that we have in the community is quite fragmented, so that when I used to work in the hospital system as part of a team, we would actually have meetings where the doctors, the physios, the dietitian, the nursing unit manager would all kind of get together and plan a patient's care together. So we would say, this week for this patient, we're going to focus on 1, 2, 3, 4, all of these things to help this patient achieve their management plans. And I felt, why do we have this disjointed kind of plan inside the community where the GP's role is really just a prescriber and a referrer, and then it's up to the patients to really navigate all of the challenges inside the community and to have that responsibility on their shoulders. So what I decided to do was I actually created my own medically supervised weight loss program, where instead of the patients coming to see the doctor, once every couple of months, weighing in, getting their scripts, and then going out to see, an allied health practitioner where everything is all separate, then I decided to bring it all in-house, where you would see the GP, you would get your investigations, you would get your treatment, you would get your titration of medications, but also you would see your GP together with the team every week, because it's only when you're able to really provide regular check-ins, regular patient education, and help patients to implement those changes that true changes really occur. And so in my program, what I do is exercise with them every week. So together with the exercise physiologist, we exercise with the patients. Together with the nutritionist, we teach patients, what it is that you get at the supermarket, how it is that you're going to prepare a healthy meal, how it is that you're going to read the food labels. And what I find is that giving patients that kind of bite-sized advice each week and helping them to implement those skills has meant that even when they do achieve their healthy weight, they're more empowered and they're knowledgeable.
I love that.
And they're able to really maintain their weight in the long term, even without me. And as a GP or as a doctor, that's the best feeling in the world when your patients don't actually need you anymore, because you've given them the skills that they need to be able to look after themselves. So I decided to kind of think outside the box and reinvent the wheel, so to speak, when it comes to weight management, just because the system that I felt was a bit old-fashioned and it need reinvigorating.
Yes, I totally agree with you, and I love that so much. Oh my goodness. Yeah. That's just absolutely wonderful.
Amazing.
The teaching of patients how to succeed beyond your care is complete. Well, that is completely revolutionary and so exciting to me. I can just completely see how that would be so helpful.
Yeah, it really puts it back into our hands, doesn't it?
That's right.
Definitely.
Instead of just being told I've got this
Here's a thing to
secret.
follow. Hopefully you can. See you later. Bye.
Definitely. I feel like there's always been two major problems when it comes to weight loss that I've been able to solve for people. One problem is that it's great that we have so much access to information, but there is absolutely so much, and people don't know what information is specific for them as the individual. So they might say, oh, look, this week I'm being told to go low carb. Next week I'm being told to do keto. The next week I'm being told to do fasting. Maybe I should do a bit of both. Maybe I should do a little bit of A and a little bit of B.
Yep.
And they get kind of overwhelmed with all of the advice that is out there. And it's very hard for them to be able to have an assessment, to get some individualization on what would actually be good for them in the long term. So that's one thing that's quite difficult for people, to know exactly what it is that would best suit them. And the second thing that's quite hard for patients to do is to also figure out why it is that they've struggled with their weight for such a long time. I find that with patients, they tend to be quite solutions focused. So when patients tend to have challenges with their weight, they want an answer and they want a solution. So they might go to Dr. Google and say, tell me about the top 5 different weight loss medications, or what is the most effective weight loss surgery, or who is the number 1 weight loss surgeon in Australia. So patients are very solutions focused, and they're doing that because they're genuinely trying to do their very best to solve the problem. And often what is missing from that is a discussion with your GP to figure out what is your medical problem that has led you to this point, which has made it quite difficult for you to lose weight. Because the patient is often in control of a couple of things. They're in control of how much food that they're eating and how much they're able to exercise, the classic adage of eat less and move more. But the patient may not necessarily be in control of their family history and their risk of diabetes and their cardiovascular risk, or maybe the medications that they're taking actually contribute to weight gain. Or maybe they actually have undiagnosed hypothyroidism and their metabolism is quite slow. Or maybe they already have borderline sleep apnea and they're not actually sleeping that well overnight, and therefore they're having struggles with their weight. So having that kind of discussion with their GP to do an analysis from a medical perspective is really important. And being able to do that means that they're able to kind of come to that decision together as to, all right, this is my medical problem, and therefore, what are the options that best suit me? And I think that GPs are in a great position to have that conversation with patients and also lay out all of the different options that might be available to them.
Yeah, I love that. I think probably one of the biggest barriers is from my personal experience, and I think probably a lot of people that have lived life in a bigger body have experienced the fear that can be associated with going to your GP and feeling like maybe it will just come back once again to diet and exercise, and full well that you've tried those things and that it hasn't worked. So is there a way, or what is the best way to get an accurate diagnosis, I suppose, and a good path forward? And how do we know who to go to and who to see? Because in my own experience, while GPs are very wonderful and they're very well trained in so many areas, I know that I've had a problematic relationship with my GP in the past. Not now. Now I have a wonderful GP who's very good and very helpful, but that hasn't always been the case. What would you say to people who are listening that are in that position?
I have heard it many, many times from many, many people that there are so many barriers to accessing care. And I completely agree with you that sometimes it a barrier is put up against them when they are seeking help. And it's not always the fault of the patient, and it's not always the fault of the GP either.
Agreed.
And
Yeah.
I think that there are two parts to this question. The first part is, how can we make the conversation easier to start from a GP perspective, so that it's a more open conversation and so that patients are welcome to be able to have this kind of conversation. And I've recently been appointed by the Royal Australian College of GPs as the New South Wales state lead, because I have been doing lots of educational activities like speaking at the Wonka Sydney World Conference on weight management, and also doing lots of patient education out in the community as well. And I think that that's all that we really can do, which is really advocate for a open conversation, a destigmatized approach, and just accepting that people need help. And even if you're not necessarily going to be prescribing weight loss medications, or if you don't feel comfortable, or if it's not your niche, because not everyone has weight management as a subspecialty. Some GPs are excellent when it comes to eyes. Some GPs are excellent when it comes to skin. Some GPs are excellent when it comes to all sorts of different things, because being a GP is not always about being the best in 100 different specialties. It's about being broad, but also knowing where to refer. So I think that on one side of that is, when you are a GP that does have a special interest in weight management, it's important to be able to advocate on behalf of the patients and make sure that you are able to help other GPs help their patients. So that's something that I'm working very hard to try to do. The second thing is having a look from a patient perspective. So from a patient perspective, how are we going to empower patients to be able to start the conversation with their GP, especially if they feel like it might be a bit of a vulnerable topic, or if they feel that they're going to be shut down? The first thing to do is to give it a go, and don't be too scared. And know that if it doesn't work the first time, it doesn't mean that all of your hopes and dreams are over. It means that maybe this person wasn't the right fit, and it's okay. And maybe this GP doesn't have weight management as a subspecialty. Maybe they're excellent in skin cancer checks, but they're not excellent when it comes to weight management checks, but a colleague might be excellent when it comes to weight management. A good way to find out whether your GP does have weight management as a special interest is to have a look at the doctor's website and to have a look at what their special interests are. So you might see that there is a particular doctor that has a special interest in weight management, or someone who has a special interest in travel medicine, for example. And then I would just make an appointment with that doctor in particular, because if you're seeing these patients day in and day out, you get a lot of practice, you get a lot of experience, and it becomes easier for the doctor and easier for the patients to have that conversation. The other thing that you can do is that there are a lot of GPs who do work in weight management clinics these days as well. And often you can locate those clinics. I have my own weight management clinic, and also my colleagues around the country in different states also work in weight management clinics themselves. And those weight management clinics tend to cluster GPs together, where those GPs do have a special interest in weight management. And some people say, oh, is weight management just about prescribing weight loss medications? It's not always the case. It's about knowing about the different types of weight loss surgeries that might suit a patient. It's about knowing about the nutritional requirements that are required if a patient has had surgery and post-op. It's about knowing about the nutritional requirements if someone is taking weight loss medications and they're needing to be able to nourish their body during that journey. And it's also thinking about those complications of weight loss or chronic disease that might happen with weight gain in the future. So it is very much not just about weight loss, but it's a full-scale metabolic health kind of perspective that these GPs have. So if your GP is not necessarily the right fit when it comes to your weight loss journey, having a look at the practice website to see if there is a colleague who does have weight management as a special interest, or having a look online to see if there is a weight management clinic close to where you live. That would be a great third option.
Excellent.
Great information for people, because I know when I would look at different things that I needed, you just go to the same GP all the time and hope that he knows something, or that you might get the answers that you're looking for. And I think that was a real barrier for me, that I sort of didn't realize that it was okay to go to someone else for certain things.
And Dr. Angela, do you find that, well, say for somebody that lives rurally, or somebody that's living just outside of a metropolitan kind of an area, are these types of clinics and doctors that have special interest in weight management and metabolic health, would they be open to, or do any of them have that online option, those types
Yes.
of options for people?
The great majority of them are mixed, where they do face-to-face and telehealth appointments.
That's
because
excellent.
The great thing about weight management is that it is a subspecialty where patients can hop on the scales by themselves to measure their weight. Patients can also get out a tape measure and measure their waist circumference. And another way that I get patients to monitor their progress is by doing photograph measurements as well. I don't know if you've heard of the app called Me360, and I don't have any affiliations with the app, but a lot of my patients will do a monthly picture where they're able to put their pictures side by side and see what their progress is. So because weight management is one of those subspecialties in medicine where you don't necessarily have to see the patient that often and examine them, and the patients are able to measure those essential numbers themselves, it is a specialty where we can do it by telehealth. And you'll notice that a lot of the weight management clinics offer care face-to-face, and they do offer it by telehealth. And the amazing thing about that is that for some people who live in the most rural and remote areas of Australia, it is actually easier to get an online appointment with your weight management doctor than it is for you to even get an appointment with the local doctor. So it has really opened up access to a special area of medicine for people who would otherwise have a lot of difficulty accessing that.
Yeah, no, it's very exciting. It's very heartening for us working in the community and supporting the community that we support on Bariatric Support Australia. We just hear so many stories, so many people that just need to have that really empowering and helpful relationship with fantastic general practitioners. And in my own life, my general practitioner has made an incredible difference. And I just wish that everybody could have that type of a connection and that type of a relationship. And it sounds like we're very much moving to a time when that will be possible, which is wonderful. Yeah. So thank you so much for all that you're doing, you and all of your colleagues that are very passionate about this area.
Definitely. It's such an important topic, with the increasing amounts of obesity and the increasing challenge that people are having with their weight. For doctors to be getting excited on the topic and upskilling on the topic and wanting to open the door and start the conversations with patients feeling welcomed and ready to start the conversation. If we can bring the two parties together, it's going to be fantastic.
Yes, I agree. Yeah. I'm very excited about that. So is there a place where, like, if somebody's listening and they would just like a place to start, just where would they start looking for a GP that has a special interest in weight management? How does one go about that? Is there a national database? Is there?
There is not a national database, but I can provide we need one, don't we? I can provide a set of links to some weight management clinics that you can provide as a resource after the podcast, and people will be able to click on those links to find the nearest clinic in their state. How about that?
that is wonderful.
Yeah.
I think that's excellent.
That's excellent. So how do you I know you've only just sort of recently been appointed the chair. What are sort of some of the things that you're excited to be working on as far as the state initiative goes?
Well, something that I've been working on when I've already been educating GPs and doing some case studies and doing some presentations is I've been trying to share information about the way that I approach weight management, which is not necessarily just pharmacotherapy. I think that there has been a lot of excitement when it comes to weight loss medications, both from a patient perspective in that, gosh, we have so much new medications on the horizon, and also from a prescriber perspective as well. Gosh, we have so much development in the weight loss medication space. The percentages of weight that you can lose are increasing, and they're starting to approach bariatric surgery. Both parties are getting so excited, but at the root of it, I think that when it comes to weight loss, yes, for some people, they may need to take weight loss medications for some time, and a small group may need to take it even for lifelong. But at the heart of it, I think something that's very, very important that I've been trying to advocate for and spread the message about with other doctors is that we never forget to assess the patient and make sure that we have addressed any reversible causes when it comes to their weight. So before we jump into the solution and give a patient a referral for surgery, or before we get out that prescribing pad and write a script for a weight loss medication, let's be true to ourselves as clinicians and assess the patient and make sure that they have all of their medical needs addressed, and we're making sure that we haven't left any stone unturned. So that includes a very, very thorough history and assessment, doing some bloods, and making sure that we just haven't missed anything, and we've included all of these factors inside our weight loss plan. Because if you have not addressed those factors, when someone has gotten to their goal weight and when you're weaning the weight loss medication, or if they've had weight loss surgery, if those factors are still unaddressed and they still have untreated hypothyroidism, or they still have untreated pre-diabetes, you can almost guarantee that the weight is going to come back at some stage and you will still need to address it. So it is so important to do that assessment stage with your patient at the beginning of every weight loss consultation.
Yep.
So important.
Yes, I was just, as you were talking, Dr. Angela, I don't know how much Damien shared with you, but back in the day when Damien had his surgery, he was cured of his diabetes. And then it came back.
And then it came back with a vengeance.
And we were all a little bit horrified, weren't we?
Yeah.
Which is, potentially something, I suppose, that that now could have been avoided by, a bit more thorough history taking and all of those things.
Yeah.
Yeah.
Definitely. And I'm always a little bit cautious when I hear stories about people losing a significant amount of weight, having a subsequent blood test and being told you're cured, you're free, you're no longer diabetic. Because if the patient had been struggling with their weight for such a long time, and if they had underlying pre-diabetes or insulin resistance, and they have lost a percentage of their weight, there is something that was there. There is something that was medically there, and you can't say that you've done one blood test and that patient has been cured. Someone's health is going to need to be monitored for their entire life. And also with aging, our bloods are going to change as well. So there is such importance that needs to be placed on long-term monitoring and having that relationship with your GP to see whether anything is changing so that you can act really early and make sure that it doesn't get to the stage where you're having any of those kinds of complications.
Yes.
Yeah.
I love that, and I cannot agree with you more. It's so important to have that really good relationship I mean, I know for myself, because I have some, I've had some medical issues come up just of recent times, to do with my own surgery. And it was all sort of somewhat flagged by my GP prior to anybody else picking anything up. And I think that it just comes back to being diligent as well as, and I take this on myself, but being diligent as a patient and going in for those regular checkups, making sure that I'm being regularly monitored. Because once, in my opinion anyway, after you've had a bariatric procedure, then I believe that I was then submitting myself to be monitored quite closely for the rest of my life.
Definitely. It is a long-term commitment. Once you have made that decision for yourself that you're having surgery, it's not committing to the surgical date. It's not committing to 6 months of recovery. It's not committing to 2 months of rehab. You have committed to a surgery that is going to change the course of your life, and your absorption is going to be a little bit different for the rest of your life. The gut bacteria is going to be a little bit different for the rest of your life. Your risk of chronic diseases is going to be reduced. However, your risk of malnourishment is going to be higher for the rest of your life. So it is so important for you to have that long-term relationship with your doctor, so that you can really, knowing all of that information, be armed with it and prepared for it, and prepare and kind of prevent any complications that are going to come up by staying on top of it at all times.
Yeah. Yes.
So it really isn't something that should be taken lightly, that, going down that whole process of having surgery.
What is the process that you personally take somebody through if they're coming to you and they're saying, because they've done their research, and as you said, they're in that solution mode, they're going, okay, I want to have weight loss surgery, so they come to see Dr. Angela. What is the process that you have, that you take people through?
Yeah, I would always take them back to first principles. So the first thing that I would do is explore their wishes around weight loss surgery, because usually people have done some background research by the time that they've come in for the doctor's consultation. So if they come into the doctor's consultation and they say, hey, Dr. Angela, I have decided that I would like to have weight loss surgery. Can I please have a referral? It usually goes that way. And I will usually know that they have done some kind of background research, in that they know who they would like the referral to. They have chosen a particular type of weight loss surgery because they've seen that side by side with a couple of different types of surgery, and they've made that decision based on some of the risks and also based on the percentage of weight loss. They know a little bit about the complications, and they have somewhat decided whether it is financially viable for them or not. But sometimes what they have not thought about is whether weight loss surgery to begin with is going to be the most medically suitable option for them. And also, where does this sit in terms of the other options? So that's what I would normally say to them. What's brought you to this decision where you have decided that you're thinking about weight loss surgery? Is it because of the type of the procedure? Is it because of the percentage of weight loss? Is it because of the, the short-term intervention and the one-off cost compared to some of the other things? Or is it because you're working towards a goal within a significant amount of time? And so it's important to know exactly what factors have led to that decision. And then I would say to them, can I ask you a few questions so that I can figure out where you are at from a medical perspective? And then I'll ask all of the usual things that I might ask during a medical consultation, like, can you tell me a bit about your family history? Do you have any family history of diabetes or thyroid disease or high blood pressure or heart disease? So I'll ask about those kind of things. What medications are you taking? Do you have any allergies? Can you tell me a bit about what a typical day on a plate looks like for you and what your exercise looks like? So I ask about all of those kind of things that a doctor would normally ask during a consultation. And then I say, this is one of the options that you have found, which is this weight loss surgery. And I'm just going to put this option side by side against all of the other options so that you can kind of compare and contrast all of the different options and just make sure that you feel comfortable that this is the best decision for you. And then what they will often say to me is, wait a minute, what do you think is the best option for me from a medical perspective? And that's where the conversation kind of gets interesting, because when it comes to a relationship with a doctor and with a patient, sometimes it is patient choice, and it's only patient choice that happens during a consultation where they 100% know what they want and they would like to get that referral to that bariatric surgeon. But sometimes it is a shared decision-making process where they've come in with an idea, I have presented all of the options side by side, and then they kind of get to sit on it and have a think about, wait a minute, is this something that is going to solve my specific problem now that I know where it sits compared to all of the other options? And so it's kind of food for thought, and that way it's kind of a shared decision. And I think that that's the best way for a patient to make a decision about their health, when they have all of the available options side by side in front of them, and they've been able to have that individualized consultation with their healthcare provider. So that's the way that it would normally go down in my consultation group.
No, I love that. I think that it's so important and so empowering to have all of the options and understand how they may impact you based on your own health and your own medical history and your own challenges, rather than just a one and done or wanting a tick and flick.
Some patients would like the quick referral, though, I must say.
Oh, yes,
They say, I thought this would be a quick one, Dr. Angela.
Well, I think that they should be very heartened when it's not a quick one, because it really is. It's, as you said, when you said that it is a life-changing surgery, it is in so many ways, and so many ways that I don't think we really understand until after it's happened. But it does impact everything.
Yeah. Well, even for me, like when I had my surgery and, I got through all the liquid stages and everything, I physically couldn't eat chicken for like 3 years. It just, the texture of it, I don't know, just made me sick. But I was always a big chicken eater.
Yes.
So suddenly I couldn't have one of my favorite foods anymore. And, that
Felt like your life was going to be over.
Some patients do say that to me. They say, I used to have a favorite food and now I look at food. I'm not even attracted to food. It doesn't really give me pleasure anymore. That's a bit of a shame, when normally you would enjoy food as a family around the table. But do you know what some other patients say to me as well? They say, sometimes I can't quite appreciate the weight loss that I have had, even though I can see the numbers on the scales. So even though I have had, 20 kilos weight loss, even though I have had 30 kilos weight loss, I don't feel it in myself, and I don't feel like I can celebrate it just yet, because I don't feel that I even mentally deserve to be 20 or 30 kilos lighter. There can be a bit of a time lag between when your body changes and when your mind actually accepts that change actually kicks in.
Oh, I agree with that. Damo and I were talking about this just for myself. I think it was yesterday. We were having a little chat about just some struggles that I'm personally having now. I'm 6 years post gastric bypass, and so I've been at my goal weight now for 5 years, and my weight may fluctuate a kilo or two in either direction. So it's been very, very stable. But there are still times where I still turn sideways to go through doors, and there's times where I still do strange things, and I think, oh goodness me, what's going on in my brain? Like the time lag, it hasn't quite caught up.
Yeah.
Do you know an exercise that I normally get patients to do if they have some trouble understanding or letting that feeling sink in with how much weight that they have lost? I get them to do a biofeedback exercise. So say, for example, you started at 100 kilos and you lost 20 kilos to get down to 80 kilos. And you're like, oh, I lost 20 kilos, so be it. I don't feel that much smaller. My clothes are a little bit looser. I haven't really downsized my wardrobe just yet. I don't know if I really deserve to say that I've lost weight. It's only 20 kilos. I get some of those patients. What I get them to do is get a backpack and put some textbooks in there, or put in some cans of corn or canned soup,
Oh
hop on the
gosh.
scales and make sure that the backpack has about 20 kilos inside there, and then go for a walk around your house for a good 5 or 10 minutes and do the things that you would normally do with that backpack on. So go and fold your
Wow.
laundry. Go and bend down and pick up some things off the ground, go up
Yep.
and down the stairs, and pretty soon your
Yeah.
joints, your back, your knees, your hips, your pelvis will sink in and realize just how far that you have come. And when you take that backpack off, that 20 kilos off, then you will finally get that kind of feedback, which is not a visual feedback. It's actually a feeling that's deep within you. You will have that feedback and you will like, I appreciate being 20 kilos lighter and walking around without that backpack every day. And I'm going to enjoy it and I'm
Wow.
going to embrace it, because every day is so much easier for me to do those little things. And I'm going to own it. I'm going to go buy a new dress.
Yeah.
I absolutely love that. I mean, like, because I lost 100 kilos. So I'm thinking about,
Oh, that's going to be a big backpack.
Yeah, I don't know. I wouldn't even be able to lift the amount that I lost.
Wow. But no, I'm actually going to do that. I think that's a fabulous idea.
You boys have a weight set.
Yeah, we do.
There,
we've
so
got weight plates. So I'd be able to put, some weight plates into a backpack and try and go for a walk. And probably
Go do your biofeedback exercise and tag me and let me know how you went.
I will. I'm going to do it, Dr. Angela. I'm going to do my biofeedback exercise.
Yeah,
I'm going to write it down.
And I think that's a good thing for some of our members on BSA.
Yeah, I agree.
To look at, because we have a lot of people that, I don't feel like I've lost anything, and like all the things that you said, but you see their side by side pictures, and you can see
it's
that
massive
they've lost
difference.
And the changes. And I think doing that biofeedback would be a great exercise for a lot of people.
So powerful to feel it.
Yes.
To
feeling is believing.
Feel it. Yeah, it is. I mean, seeing, I don't know, there's still a disconnect for me anyway. There's still that disconnect, but actually feeling something, I think would be so powerful.
Definitely.
What a clever lady you are.
Yes, love it. So what do you think some of the misconceptions that people have when they're thinking about weight loss, or just the obesity management sort of stuff? Because there's always been a lot of negative talk around people that are living in bigger bodies, and all the stigmas and stuff. But what are some of the sort of current misconceptions that you see floating around?
There's a couple. The biggest one is that weight loss is as easy as eating less and moving more, or weight loss is all about calories in versus calories out. If it really was that easy, then we wouldn't actually have a problem when it comes to weight, because there are so many different ways that you can manipulate eating less and moving more. There are so many ways that you can cut your calories. There are so many ways that you can fast. There's so many ways that you can go low cal. There's so many ways that you can burn calories through exercise. There must be something else that is not being addressed in order for people to achieve sustainable weight loss. And I think the missing link is making sure that there hasn't been an unturned stone and that
Yeah.
people are being really diligent and thorough and checking to see whether there is a medical factor. So one of the guides that I'm going to give you that you can give your listeners as well is my weight loss guide, and it just
Yep.
outlines those factors. So it's a 10 question questionnaire where people can ask themselves some questions and see whether they do have genetic factors, if it's medical
Yep.
factors, if it's behavioral factors, and people can kind of identify whether they do have factors, and then they can start that conversation with their GP, which will make it a lot easier.
Yeah.
So
That's
that is
wonderful.
the
That's great.
biggest one.
Yep.
One of the other ones that might be a bit controversial when I say that is that I think that there is a bit of acceptance around taking medications for weight loss forever.
Yep.
And I say that because even though there is a group of patients where sometimes you can't always help them reverse the factors when it comes to their weight, there will always be a group of patients where they have conditions that are very difficult to control that will always cause escalating weight gain. Or there are some patients who will, in the long term, need to be on medications that do cause weight gain and you can't switch it out for weight neutral alternatives. Those are patients where I would consider that they need to be on weight loss medications in the long term. But for the great majority of patients, I've been able to use weight loss medications in a bit of a kickstart fashion while we're treating the underlying cause. And that means that we've been able to wean down the weight loss medications and just help them to control their weight in the long term with changes to their lifestyle. And it is so empowering for people to know that when they're starting this weight loss journey, there is going to be light at the end of the tunnel where they're not going to have dependency on weight loss medications to control their weight forever. I think, and I will be a bit controversial, and some doctors might disagree with me and they might say, you need to accept obesity is a chronic disease. And therefore, once you start patients on weight loss medications, you have to accept that you're going to prescribe it to them for the rest of their life. I don't really accept that for all patients, because for the great majority of patients, I can find a couple of factors that I can help them to address. And that means that for the great majority of patients, when we start the weight loss medications, I say to them that I don't intend to prescribe it to them for the rest of their lives, that we are going to use this to kickstart your weight loss journey while we address the root causes for your weight gain. And I need you to start from day one to start changing your lifestyle so that you have the skills that you need to maintain your weight in the long term.
Yeah.
Amazing.
I love that. And, I often, because after my bariatric procedure, I became extremely passionate about learning about nutrition for myself. I realized that I lacked information. I needed to understand. And since I have changed so much about the way that we eat and the things that we eat as a family, I've watched my children, who obviously have had no bariatric procedures, understand their own bodies and be able to have times like, for example, over the Christmas holidays, they actually joke because they know that they're going to gain X amount of weight because they're going to make certain choices around lifestyle and also around food during that period of time. And then at the end of that time, they go back to what they know that they do all of the time, and the weight comes off just that easily. And I will always wonder, if I had understood things differently, if I would have had to have made the choice that I made 6 years ago or 16 years ago when I first had lap band. I'll obviously never really know the answer to that. And with the genetic factors in my family, probably I did make the best choice, but I'll always wonder. So
Definitely.
I think that it's really great and very empowering that people have the opportunity to really learn and dig deep prior to choosing to just jump onto bariatric surgery as the answer, because it's only a part of an answer, from my experience anyway.
Definitely. And I think in nutrition is something that's really important as well. And I can understand your feelings that you have right now, that you are thinking and reflecting on the experiences that you had as a patient. And you're starting to think and plan about the generation underneath
Yeah,
you
that's right.
because they have the same genetic factors that you
That's
do.
right.
Just as you were affected by genetics in your case, and environment had its contributions as well, you're thinking, oh gosh, my children have 50% my genetics. What does this mean for them? Of course, they can be 80% good most of the time with their choices and enjoy things around, festival time, Christmas time, and
Yeah.
bring themselves back into a routine. But what does this mean for my kids? And,
Yeah.
all that we can do is be the best that we can be in terms of
Exactly.
filling our pantry with lots of healthy choices, sitting around the table and eating protein rich, nutrient dense type foods and celebrating that as normal and just
Yeah.
being good 80% of the time and knowing that, yes, we're going to enjoy the occasional treat, but most of the time we just eat well. And it's not about dieting. It's about fueling your body
Exactly.
with lots of good quality nutrition, which is what it needs.
Yeah. Yep. I love that. Oh, I love
It's
it.
brilliant, isn't it?
Yep. It really is. It changes generations.
Yeah,
It does.
it does. I mean, we've seen with our daughter, she's dropped a lot of weight this year, and it's not something that we've ever discussed with her because we want her to be
Comfortable.
the best girl she can be and an amazing human, but she has noticed that she can eat certain things and the way she feels when she's doing it. And she came out the other night and I'd done some homemade baked beans and we had a barbecue as well, but she just had this little bowl of baked beans and I said to her, sweetheart, you can have, I'll make you something else if you don't like it. She's like, no, I like this is all I want.
Yeah.
And
Definitely.
I went, oh yeah, just let her make those choices.
Yeah.
And she was happy, and it made me really happy because I thought, yes, she's not feeling like she has to eat everything because dad won't do this again.
It
She
makes you
just,
proud when you
yeah,
have been modeling healthy eating and your kids choose that as their default now. What an amazing feeling, right?
Yeah.
yeah,
Yeah, it absolutely is. It's been so empowering. It's wonderful. I mean, I love it. I absolutely love that part of it. Knowing that that they understand the tools to be able to carry them through their lives and hopefully avoid some of the pitfalls that I fell into.
yeah, yeah. So, a couple of questions that we like to ask our guests. If you could choose a superpower, what would you choose?
Gosh, that is a very tricky question. A superpower. I
Besides
would
being an amazing
choose
GP
to I would choose to help patients. I would choose to help patients maintain their weight in the long term because actually that is the hardest part of the weight loss journey. So I find that when it comes to the weight loss journey, you got to think about it in terms of stages. So you got to think about it in terms of losses where you get to your goal. You got to think about it in terms of a buffer stage where you lose that little bit extra so that even if you lose or gain around like festive season or around like ski season or whatever, you got that extra 2 kilos of buffer weight so that you're able to protect yourself. And then you've also got to take into account that as you age, you're going to gain a little bit each year as well. So you kind of got to have that little buffer as well. But the maintenance phase where you're trying to keep your weight nice and stable can be a bit of a challenge. I give my patients a lot of tips when it comes to maintenance, which is, of course, making sure that all of your medical things are stable and nice and controlled. You're getting in enough protein, you're getting in enough nutrition, and all of those kind of lifestyle-based things. But for people who are not necessarily my patient and getting that kind of feedback, I wish that I had a magic power so that as soon as they got to their goal weight, I could just wave my wand and they would stay at their weight, because I know that is the hardest part of the weight loss journey. And if I could just grant that to people, I would be a very happy and maybe very popular doctor as well.
Yeah. We spoke to a weight loss surgeon a little while ago, and I'd sort of said how I'd had a bit of a regain and, that I've been maintaining. And he said, well, how long have you maintained this current weight? And I was thinking about it, and I said, it was about 7 years. And he just looked at me, he said, that is incredible. He said, you should be so happy with that, because, it's so hard to maintain.
Yeah, the maintenance thing. So what are your like top 3 tips for maintaining?
The first thing is making sure that you're getting in enough protein. So any patient who knows me or anyone who's seen any of my social media knows that I have this mantra, which is like protein first, protein first, protein first. Like any time that you're thinking about your breakfast, are you having eggs and what are you having on the side? When you're having your sandwich, what is the protein that you're having on your sandwich? Are you having butter chicken? Butter chicken is not butter chicken, it's chicken butter. You got to have your protein and then you think about the other things that you're serving with it. So protein first, that is always going to help you when it comes to losing weight, in terms of firing up your metabolism and in terms of controlling your appetite and maintaining satiety. So that is important. The second thing is staying active, but you don't actually have to work really hard when it comes to exercise. I see so many people who have the wrong idea when it comes to exercise, and they think that for exercise, you have to commit to like 3 months membership at the gym where you go 5 days a week, you slog it hard, you do an hour each time, and then you do nothing afterwards because you're so tired, so injured, and you can't actually maintain a quality of life. If instead you just did like 2 21-minute exercises throughout the week where you got a bit huffy and puffy and it's difficult for you to be able to complete a sentence, if you were just exercising at that kind of intensity, which is often just cleaning the house or gardening or doing that kind of level of activity, that's going to be good enough and it's going to be sustainable. And that's all that you really need for exercise. It doesn't have to be deliberate. You don't have to leave the house. And when you're doing things that you need to do around the house anyway, you'd be surprised how many weights that you actually pick up, like moving in the groceries, doing all of the cleaning. And so it's a cardio and a weight-based training exercise anyway. So choosing things that are time efficient, easy, sustainable, things that you can do at home. These are the keys to successful weight maintenance in the long term.
Excellent.
I love Dr. Angela.
I do too. But we knew that would be the case.
Yes. What do you enjoy doing for your downtime, just to relax?
I sound like quite a nerd, but I actually really like fixing things. So in my downtime, I find problems and I try to solve them. A couple of different things that I've done in the past is when we had COVID at our surgery, there was actually a shortage of masks. I don't know if you remember that happening. Our doctor's surgeries did not have PPE. We didn't have masks. We didn't have face shields. At one stage, I was actually sewing masks for the staff, and I was actually making homemade face shields. But I actually came up with this company and made a mask vending machine so that patients could actually like tap their card or put in a coin and put on a mask before they got into the surgery. And I'm working on something else right now in the background so that I can solve another problem. So whenever I kind of have a bit of downtime, that other side of the brain is always working on, what is it that we are missing right now? and
Yep.
how can I solve the problem and make something specific. So yeah, that's what I do. It's
I
actually,
love that.
I find it kind of relaxing, but I think
Yeah.
it's part of that GP mindset. If I wasn't necessarily a GP, I think I might be a handy woman. I would still fill my days going around the house and fixing things for people.
I
I
love
love
it.
that.
But,
Yeah.
yeah.
Problem solving.
Yeah.
Yeah. I love it.
It's like another superpower.
It is.
And what's your favorite meal to eat?
Simple foods. So if you've seen any of my social media, I
Yep.
am not fancy like Bo the nutritionist. Bo the nutritionist does these beautiful foods that look like rainbows. They've got like 10 different colors, a wonderful source of protein, and lots of colorful fruits and vegetables and everything else. So all of those things that you see on my social media, those are Bo's foods, because
Okay.
she does all of the good stuff. And all of my cooking that you see on there is button cooking. I have a rice cooker and I put like 5 ingredients, press go and go and do something else. Come back 2 hours later, my food is ready. So I like to do very, very quick foods where it's literally set and forget. So I might put in some chicken drumsticks, some rice, put in a couple of vegetables, press go, come back 2 hours later, dinner is served. So I'm very, very simple when it comes to food, but always making sure that there is a protein source in there for me and my family.
Wow. I
I
love,
love that. Thank you.
So with your practice, we always get listeners that will say, look, I really connected with what Dr. Angela said. I'd like to be able to go and see Dr. Angela and her amazing team. Is that an option for patients right throughout Australia?
Yes, so I currently practice weight management as part of a multidisciplinary program. So I brought out Enlighten Me back in November of 2022, and it is a 16-week medically supervised weight loss program where patients have up to 20 weeks to access all the materials, and they see me roughly every 2 to 3 weeks. So there are 6 consultations in there. Normally I would do some assessment. I will sometimes look at their bloods or send them for a blood test first and have a look at all of those factors that we talked about to check and see if there are some root causes that we need to address in their weight loss plan. And during those consultations, titrate the medications, treat the problem, and also kickstart the weight loss journey. And like I said, for me, it's not really about prescription only medicine or just giving you weight loss medication to artificially cause weight loss. It's more about fixing the problem and sometimes using weight loss medication to get the ball rolling. And in addition to that, what I think is the most important part is getting that information and getting that right information. So every week, then I exercise together with the patients on Zoom with the exercise physiologist. Every week, then I train them on Wednesday with Bo the nutritionist. Tonight actually is Wednesday. So tonight we are doing noodles and hot pot as our topic. We're comparing all the different egg noodles, rice noodles, vermicelli, and what are the good and not so good ingredients to put in your hot pot so that people can have hot pot this week for their dinners. And so that's what I do as part of my weight loss program, because I believe that when it comes to weight loss, it's not really about just seeing the doctor and getting a script. It's about having that kind of thorough consultation and at the same time getting the skills that you're going to need to be able to control your weight in the long term. So when people join a program like this, they kind of need to be ready to go all in terms of their time so that they can really commit and they're going to be able to make the most of a program like this. And I can definitely give you a link to that afterwards that you can share with your listeners.
Yeah, we'll do that.
Yeah, that's excellent.
Wonderful. Thank you.
And I think it's a great investment to make, even if you are looking at having weight loss surgery, to just put that, I'm going to spend the next 16 weeks.
I'm going to commit to myself. I'm going to give myself this time.
and give
Make
myself
this
the
investment.
best chance to
Yeah.
maximize whatever plan.
Yeah.
So, no, I think that's wonderful. Dr. Angela, thank you so much for joining us. We have had a great
Yeah.
time.
Thank you.
You're very
And
welcome.
we look forward to talking to you again.
Thank you so much for having me on the show.